Hi, Mr. Price. How are you doing today?
Not bad. How are you?
I'm doing great. My name is Dr. Dill, and I'd like to welcome you to our office. First of all, I'd like to know, is there any name you'd like to be called besides Mr. Price?
Call me Justin.
Okay, great. Justin, it's really great to meet you, and again, I'd like to really thank you for coming to our office today. And I know it's lunchtime, and I know you're busy, so thank you for spending the time to fill out the paperwork that we gave to you. As I look through it, it's going to really help me figure out how I need to take care of you. I already looked through your paperwork, and I saw that your sister Jackie referred you to us today. So thanks to her, I really know that we've taken care of her, and I know we can take care of you also. So as we get to taking care of you, I think that you'll see how well chiropractic works, and you're going to want to refer people to us or any chiropractor that your friends might know in this country. So I want to ask you a question. I'm going to ask you this as I get to telling you about what we did. I'd like to ask you, if you think back to what you learned in school, can you think about what system in your body that you think is the most important to you?
Maybe circulatory.
Circulatory system? Okay, that's very important. Your heart, we need that. We need that to beat. We wouldn't be able to live without it. So let me ask you this. What controls your heart?
The nervous system.
The nervous system, right? So I think in my mind, and maybe in your mind too, you'd see your nervous system as a little bit more important because without it, we wouldn't have our heart working, right?
That's correct.
Okay, and we want it working correctly. So I want to explain to you a little bit about the nervous system, and if you've got any questions, I want you to throw them out to me, okay?
Okay.
So we've got different parts of our nervous system. It's made up of our brain, our spinal cord, and the nerves that go out to the rest of your body. We've got one part that controls the movements that we do. So let me give you an example. Say I've touched something hot. I've got these nerves in my hand. It's my senses, it's my sensory nerves that tell me that I've touched something hot. Those nerves run all the way to my spinal cord, and once it hits my spinal cord, it's going to tell my motor nerves that, oh, I've touched something hot. It's going to travel back down and say, whoa, move that. And that's what I want it to do, right? Yeah. And then we've got another part that actually controls all the organs of our bodies. It's called your autonomic nervous system. And here I've got a chart I want to show you. So as you see, you've got all these nerves coming from your spinal cord to your different organs. And they come out of your vertebrae in your spinal cord. And we want all those working correctly, right?
Yeah.
So I want to tell you about a big word. It's called subluxation. Have you ever heard about that word before?
Maybe.
Maybe?
Yeah.
Okay, but do you remember what it means, or do you want me to tell you again what it means?
Yeah, sure.
Okay, it's a word we use here in chiropractic, and it's very, very important. And basically what a subluxation is it means that we have had a misalignment in these vertebrae that's caused an interference on these nerves, basically an irritation that's causing an interference. And you can kind of think of it like a cell phone. You have a cell phone and a cell phone tower, and if everything's working great, we have a great call. We can hear everything perfectly. But if it's not working quite right, then we have an interference. You lose the quality of call, or you might even drop a call altogether. And that's exactly what a subluxation is going to do. And we as chiropractors, we want to detect and we want to correct that subluxation. So subluxations can actually occur in a young child, even at birth. Anything, any trauma that you have, if you've fallen out of a tree, fallen off your bike, you might have had a subluxation. But those subluxations can last and keep on going. You might have had it for 10 or 20, 30 years even. And we don't want you to have that. We want to fix that, because the longer those subluxations last, you might get degeneration on your nerves, and we do not want to see the degeneration happen in your bones or on your nerves. So the subluxations might actually be asymptomatic. You might not even know. It might even be that you have like a tight muscle, or it might be that you've had some numbness in your arm and you've kind of passed it away. But those are what the subluxations might actually happen as. As you come into our office with the subluxation, you might come with a low back pain, and as you come to see us, you might actually see that you find some other benefits. Like say you have asthma. We've seen asthma patients that get much better. People with anxiety, they get much better. So those are the kind of things that we'd like to see with you. A lot of times it takes more than one visit, so you might need to come see us more than once, but we're going to kind of work that out with you as we see what you need. Okay?
Yeah.
So far, do you have any questions?
Like with posture, does the whole experience help with posture as well? Because I feel like I have bad posture in general.
absolutely. We're going to talk to you about that as we going. Because what we're going to do is we're going to do a full examination on you today. We're going to do an examination on your nervous system. We're going to do an examination on your musculoskeletal system. We might actually have to do some x-rays. And as we do that, I'm going to go through them. I'm going to see exactly what we need to do. And the next time you come in to see us, which hopefully we can get you in as soon as possible, maybe even tomorrow, I can actually start treatments. And I'll give you a treatment plan. We'll go through the costs of everything, and we'll see what we need to do to make you better. Because what we'd like to see is we'd like to see your nervous system working to its full potential.
Okay, sounds good.
All right, awesome. I'd like to thank you so much for coming in today, and I want to work with you with all your questions. So anything that you need, just feel free to ask, and we'll get your next appointment set up, okay?
Sounds good.
All right. Once again, it was really nice to meet you, Justin.
Meeting you.
All right, thank you.